My name is Dr. Kailash Mantry. I am a life coach and a mental health consultant. We have been curing more than 100 mental illnesses without medicines. Serious mental illness also, we give guarantee for treatment. Today we will be talking on brain shock. Brain shock is a life-threatening disease. The apparent reason for the brain shock is blood pressure. If the blood pressure is low, the supply of blood to the brain is slow, and that's the reason it causes brain shock. If the blood pressure is high, due to excess pressure on blood to flow, the nerves get damaged and there is a bleeding, and that causes brain shock. So basically it is either due to bleeding or due to non-supply of blood to the brain shock occurs. It's a life-threatening in the sense if within 4 hours, if the patient does not reach hospital in the presence of a neurologist, sometimes patient can go into coma and it could be a case of non-recovery. Now there are two types of brain shock. I'm not going into the technical language because this video is for a common man. One is called mini stroke and the other is called major stroke. And it is always that the first time a person gets a mini stroke and within 3 to 5 years the patient gets major stroke or paralytic attack or heart attack and some serious illness which is more dangerous than the brain shock. If the blood does not reach to the brain, neither oxygen nor nutrient can reach the brain. The part of the brain where the supply does not reach, some part of the body becomes numb and gets damaged. Every year, more than 15 lakhs people in India get this brain shock. Male are more affected by the brain shock than the female, and anybody who is above 65 years of age, and if he is a male, 66% chances are, in it, 2/3 times the chances are for getting this brain shock. And you must be aware, in India, more than 30-40 crore people are suffering from either blood pressure or diabetes or both. Males attract brain shock more than the female. Many brain shocks can recover within 24 to 48 hours, and the major brain shock takes 3 to 4 years for recovery, and sometimes the recovery is not more than 60%, and sometimes the person goes into coma also. That's why it is called a life-threatening disease. There is no age bar for brain shock to come. Anybody who takes excessive tension, who has got excessive fear, anger, sadness, overthinking, seriousness can get this attack. Young children, middle-aged people, old-aged people. But the probability of old age is very high compared to young people. 70% people get minor attack and only 30% people get the major attack. If you got a minor attack, you don't deal with your stress and tension or does not manage your blood pressure and diabetes, within 3 to 4 years, it is likely that you may get major attacks. Here also we can conclude that for brain stroke to occur, 80% reasons are psychological and emotional and 20% reasons are physical, that is accidental. Blood pressure and diabetes, you are all aware, it is due to stress, anxiety, tension. It could be due to work pressure, it could be due to family conflicts, but the root cause is psychology. But so far, the treatment for brain shock is only for the symptoms, and if the root cause are not dealt with, there are more likely chances that in next 3 to 5 years, the person will have one more attack, either of brain shock or paralysis or heart attack. We are the first one who have really understood the brain shock and can help patients to a great extent. 1 to 3 months of treatment at our center can increase your lifespan by more than 10 years. We have started online program also, staying at home, lying on your bed, you can still participate in our online program, and if the recovery is there, you can come out to our center for 1 month's treatment. People who say that it is a neurological disorder only, if all the family members come to us within 1 hour, all the family member will get convinced, including the patient, that behind brain shock, 80% chances are it is due to stress, anxiety, restlessness. Now let's talk about the sign and symptoms of the brain shock, so that if in your family or anybody nearby have got these signs, so you can help them in understanding the problem. If anybody has got a brain shock, he cannot talk properly, cannot understand what people are talking around him. There is a numbness in his face, hands and legs. He may experience headache, he may experience weakness, he may not be able to walk also, He may fall suddenly. He may not be able to see things properly, either with one eye or both eye, or he may have blurred vision. Now let's go to the causes of brain stroke. First is his pH balance is bad. Second is he's got a high cholesterol. He may be excessive smoker or excessive drinker or both. His anxiety level must be high. Either he must be believing in competition or comparison. He may be used to taking drugs for every small things, or he may be drug addict. He may experience excessive fear, excessive sadness, excessive worry, excessive tension, excessive anxiety, confusion, lack of confidence, overthinking. He may experience lack of trust. He may also have difficulties in swallowing food. He may also experience memory loss. He may be suffering from some emotional problem. His nature must be introvert nature, secretive person. He may be a hypocrite, commonly called diplomatic person. He could be sensitive in behavior, all the time feeling bad on what people say, think about him. He may be very hard worker, full of stress for more than 20 years. It is not that easy to get a brain stroke. Now let's talk about the effect of brain stroke. What are the consequences of brain stroke? They will find difficulties in thinking. They may suffer from depression and negative emotions. They will have fear, anxiety. They will lack motivations for doing any work. They may suffer sleepless nights. They will have fatigue, less energy. They will also suffer from body ache, headache. Their blood pressure may also fluctuate. They will have some eye complications. They may also face swallowing difficulties. They will also have chewing and eating problems, difficulties. Saliva may accumulate in the mouth and they will not be able to throw it out or swallow it. They are also likely to have sexual impotency. Now let's discuss the treatment, the remedies, the first aid for brain stroke. Normally, once you get brain stroke, doctors advise you for speech therapist, for acupressure, for massaging, psychotherapy, skill development, walking, dancing, but this has got only 50% role to play. They are also advised some physical activities like aerobic, dancing, but these play only 50% role. The rest 50% which we have developed, so far no brain stroke patient does it, or no brain stroke patient is advised by the doctor. Nowadays, doctors have also realized that if the stress level is not managed, if their nature and attitudes are not changed, the recovery will be slow or none. We have developed a very transparent test. The name of the test is mind mapping, in which there are more than 500 questions, and if the patient is in his senses, does the test in 15 minutes, and within 15 minutes he and his family members realize the root cause of brain stroke and then understand the importance of our treatment. Now we have started an online program also, seeing the difficulties the brain stroke patients suffer after getting the attack and is fearful of leaving his home. So we have started an online treatment. It's a 1-month treatment for the patient. The family members can also attend if he is finding it difficult to understand, and within 1 month the patient and his family member understands the root cause of this disease, and the recovery could be faster if he does this 1-month program. Now what is to be done if you find somebody has got signs and symptoms of brain stroke? First is make him lie down and let people not crowd him. Let there be good oxygen flow to him, and within 4 hours he should be shifted to a hospital where the neurologist is present, and don't give him any medicines, because unless the reasons are found, unless it is known why this brain stroke has occurred, which can be known only through MRI and CT scan, that either the blood has not reached to the brain part or there is some bleeding because of which there is a brain stroke, and for both these extremes there are different treatments. So don't give any medicines, and 4 to 6 hours are very golden hours. If he reaches hospital, chances are he will get one more chance, and if for any reason you are not able to shift him to a hospital where neurologist is available, he may go into coma, and then the recovery will be very difficult. Less than 10% chances of recovery. We are 100% confident of helping him in recovery either with speed or with percentage of recovery. In any case, he has to come to us if he wants to live long and live long healthily. We have treated more than 50 patients in the last 5 years, and we are 100% confident that we will be of help to them. Sometimes patients get vomiting or nausea feeling also. Definitely body and mind coordinations are disturbed when the brain stroke attacks. Sometimes there are complications in recovery, especially when the patient cannot reach hospital or the neurologist is not available in first 5 hours, 4 to 5 hours. Secondly, sometimes the emergency treatment is given by a local doctor in the form of some medicines. In this case also, there are some complications in recovery. Very often, brain stroke makes the person unconscious, and sometimes it appears while sleeping also. And if it goes unnoticed by the family member, and due to which there is a delay in taking the patients to the hospital, there are complications in the recovery from the stroke. In order to ascertain whether the person has got brain stroke or not, there are 3 early signs. First is, make the person raise hand like this while standing. If he is able to raise both the hands and one hand does not come down automatically, that means it is not a brain stroke. If one hand comes down automatically of its own accord, that means it is a sign of brain stroke. Secondly, make the person speak, and if he is able to speak clearly and if he is not fumbling, that means it's not a brain stroke. If he is not able to speak clearly, that means it's a brain stroke. Thirdly, whatever you are saying, whether the person is understanding or not, if he is not understanding what you are saying and he does not react to your talks, that means it's a brain stroke. Thank you once again for watching this video. My name is Dr. Kailash Mantry. I am a life coach and a mental health consultant. We are situated in Mumbai, India.